Hi, everyone. Thank you guys so much for taking a little bit of your precious time to be here with me today. My name is Douglas Fajardo. I'm the CEO of Xennial Digital. And today we're going to talk about our strategy to build a product that we call the Medicalverse, which is a virtual reality medical campus that we have already started to build along with the collaboration of the School of Medicine at the University of Miami. So to start, let me go here. We're a company based here in Miami. We are a team of 34 people, and we are focused on both AR and VR. But most of the work that we've been doing lately has been very focused on VR. That's what's coming from our clients, especially because they are universities who want to see more immersive, scalable remote learning solutions. And then, as I mentioned, University of Miami has been our main collaborator. What you guys are going to see today, it's the first version of the product that we're building, and it's already being scaled and deployed at other universities as well, which we're very excited about. I think the goal for our company is to actually create solutions that can be deployed as is in other institutions, so we can accelerate learning for the type of solutions that we're building. So the most pressing challenge that we've discovered is that demand is exceeding supply when it comes to essential healthcare workers. Especially in nurses, first responders, emergency medical professionals, and one of the main issues that these organizations are facing is the fact that physical facilities are limiting, of course, right? So when we're talking about even studies, so the first one that you're seeing there, that was pre-pandemic, 80,000 nurse applicants were rejected by nursing schools because of lack of physical facilities, because of faculty. And then if you go today to Indeed.com alone in the US, there's over 700,000 job openings for nurses alone. So the problem has been exacerbated by the pandemic. And then the other piece is when it comes to training in a medical environment, in simulation labs, one of the most difficult things for the schools to access are real patients with the medical conditions that they need to train against. So they for example, cannot ask for a patient that's having a certain type of stroke, for example, right? So there is a lot of difficulty for them to actually prepare themselves for real life scenarios. So those are the challenges that we are addressing with our solution. We also saw an opportunity, especially for our first product, to actually train students at the anesthesia that are in the anesthesia programs. As you guys can see here with this survey that we gathered with our collaborator, who is actually the director for the School of Nursing at UM. She belongs to a lot of different nurse association boards, and this is part of the research that they did. So as you guys can see here, lack of insufficient faculty was the most pressing factor there. Inadequate simulation space, inadequate faculty training. So there is all of these different areas that are actually accumulating and exacerbating the problem that the schools of nursing are facing to train their students. So this is a video that will show you a little bit of what we're building right now. So this is a rendering of the first phase of what it's our Medicalverse. The reason why we decided to go into this direction is because everybody's building a lot of single pieces of content, but there is no way to then create a single space to actually deploy all of these solutions. So in our case, this is an example of one of the simulation labs. This is for intubation. The nurses can practice different scenarios. These patients actually react with breathing. We also, aside from having audio guides, we also put visual guides and in-context screens that allow the nurses to actually see the patient's vital signs. This is the actual implementation of the solution at the University of Miami, where now, as you guys can see, they no longer have a replica of an operating room with mannequins or anything like that. They're fully using virtual reality to perform their procedures. We're actually enhancing all of these modules now with doing full hand tracking. So we're no longer using controllers because it's an easier adoption also for the students to actually use the solutions with their virtual hands. As I mentioned, this is our goal is to build this comprehensive medical campus to address these critical gaps in medicine. So, of course, obvious, with simulation labs, we no longer have any physical limitations. Our platform allows already by default to have a multi-user experience. So we can bring instructors, we can bring students from different schools even to collaborate with each other. We also have a multi-language lab because we understand that as we scale these verses or this our product, the medical verse, we're going to allow doctors, professors to interact with each other from different parts of the world. And of course, one of our major strategic plays is actually developing the largest library of virtual reality patients with embedded medical conditions. That's the way in which we're going to be able to build environments that actually are going to be helpful for the students to practice scenarios with the kind of patients they face in hospitals, different age ranges, different genders, different diverse backgrounds, and so on. So that's what composes our solution. In terms of also the components of the platform itself, as I mentioned, it's what we call the secure VR content distribution platform. It's our top part here. We authenticate actually the students and the users that are coming into this platform, so only authorized users are coming in. We can do that through our own platform, but we can also do it through the learning management systems of the schools. In terms of the labs, we've built, I'm gonna show you in the next slide, the 5 labs that we built. We actually just deployed a 6th one, which are the content layer. And then underneath that, we have already an embedded XR analytics platform where we can grab every single interaction that the student is doing inside of the virtual reality environments. This is our first product launch. It's actually going to launch in the Q1 of 2023. We've been grateful enough that we have already launched at University of Miami. We also launched at University of Central Missouri, and we have a lot of conversations going on right now with different schools, both from Florida as well, from other states, and even some conversations with schools of medicine in Latin America as well. It's very focused right now on anesthesia because that was kind of like we wanted to first understand on the high end what we could accomplish. Especially because we started building some of these during COVID, and intubation was a big requirement when we started building this. Now the next products that are coming out are more on the basic like IV skills, phlebotomy, EKG practices, because we understand that we also have to get out to the ground level to teach the basic skills that the nurses need and first responders. We also, as we were implementing this at University of Miami, we felt it was really critical for us to start gathering feedback from them around the experiences, around the content, and what impact it was having in their learning. So we had 40 students participate in that study, as you can see here. And from that study, we were using the Meta Quest. That's because the school had already purchased the devices, so that's what we deployed against. As you can see here, well, we were using at that point controllers, so they found the controllers pretty easy to use. And of course, we had a 5-point scale here, and the top 2 scales, it was 100% that people agreed that they were friendly to use. But also, you know, in the way in which we were building it, we wanted to also understand if the sequence of actions, the instructions, the visual cues that we were providing them were useful for them to learn and understand. And as you can see here also, we got 100% on the top 2 tiers there. Also, the environment, even though with the standalone headsets, we can only get to a certain point of realism because, I mean, most of you know, we're limited by the capabilities of the graphic chipsets in the headsets, but we were able to create enough of a realistic environment for us to get also 100%, as you can see here, that they were able to orient themselves into the environment itself that was fairly realistic. And then in terms of would they want to recommend this to their peers, and then so we could scale it to other areas of the School of Medicine, we also got 100% as well. So it was interesting to see that a lot of these students that we were working with, it was their first time using VR, and they were still wanting to continue and wanted more content to be able to continue learning in this manner. So what's next for us, and I think also for the industry as well, because I think everybody is hoping for this, but for us is we're going to focus on the areas in the medical field and the healthcare field that have the most critical shortages of staff. So nurses, as I show you some numbers there, I mean, it's crazy that we have over 700,000 job openings for nurses. In first responders is also a high number. So we're going to focus on those areas. We're also going to continue to work very closely together with subject matter experts. So we are, even though we started this process with the University of Miami, we're having conversations with other even companies in the healthcare field, as well as other universities involved in medicine, because for us is how can we create a very diverse set of products that we can bring out to the market that actually apply to a diverse set of schools as well. And then we also see, we've seen an interesting opportunity, not only with large medical companies, but also with large hospital chains that we're having conversations with that they would like to use our medical verse as the place where they can build their own training as well. It would be more of a custom build, which we don't want to do too much, but I thought it was interesting that we were coming to do that because they want to already use existing environments in order to deploy their solutions. And then, of course, 5G is going to be critical. We already created a partnership with one of the leading 5G companies in Latin America. We're going to start testing real-time cloud-based scenarios with 5G. We think that's going to be important in order for us to scale in the future as well in terms of allowing, especially the multi-user experiences. Also, scaling patient scenarios is going to be key. I mean, you guys have seen in the news, especially in the last few months, how voice to text to images is creating all this incredible art and different images. So we feel that AI is going to play a key piece here for us to in the future create a scalable patient scenarios and virtual patients with different medical conditions because I mean, the way I can feel pain or you or whoever is different, right? So that's what we want to make sure that how do we integrate these key technologies to bring in more scalability in terms of the product that we're building. And also, of course, the head of haptics, they're the ones that are advancing the fastest in terms of haptics. But for our industry and for our solutions, we feel that haptics is going to just take virtual reality to the next level, right? We have now a way to do some audio. We do audio, of course. We do all the visual stuff. And then we're also using haptics with the controllers, but the haptic gloves are going to be critical to our solution into the industry as well. So with that, thank you guys so much for your time, for being here. This is my email. Feel free to connect with me through LinkedIn, through email. And I'll be happy to have conversations with any of you guys about anything related to virtual reality, especially in the medical field. So thank you, guys.